Hello everyone, my name is Aya Marachi. I'm presenting today an interesting case of retroperitoneal fibrosis caused by IgG4 related disease. This case highlights the importance of recognizing this disease process at an early stage in order for us to start treatment and prevent organ damage. Our patient here is a 44-year-old Caucasian male who presented to the emergency department with generalized weakness, back pain, and 25-pound unintentional weight loss over the previous 3 months. Labs on admission showed creatinine of 14, and CT scan of the abdomen showed extensive soft tissue density encasing the abdominal aorta and bilateral ureters, causing moderate hydronephrosis bilaterally. A pancreatic mass was also found, and varices in the left upper quadrant. While at the hospital, he underwent bilateral ureteral stents placements and a biopsy of the retroperitoneal mass. And as you see in the figure over there, you can see that the pathology showed fibro-inflammatory tissue comprised of thick bands of hyalinized collagen with an inflammatory infiltrates containing IgG4 positive plasma cells, lymphocytes, and eosinophils. The final diagnosis was retroperitoneal fibrosis due to IgG4 related disease. He was started on lower dose of prednisone, 10 milligrams daily, but had minimal response, so the dose was increased to 80 milligrams daily, and then the creatinine started to improve rapidly and trended down to 1.8 within 5 days. He was discharged home on a high dose of prednisone for 3 months, then was tapered down over the following 3 months until he was on 20 milligrams daily of prednisone. CT scan of the abdomen done after 6 months of treatment showed a resolution of the hydronephrosis, significant decrease of the pancreatic mass, and periaortic soft tissue fibrosis. This response to the steroids confirms the inflammatory process of this disease, which leads to the formation of that fibrotic and sclerotic tissue that rapidly progress to surround and obstruct the abdominal organs and the ureters. Most of the cases are idiopathic in nature, and the individuals affected, they're usually between 40 and 60 years of age, with a 3-to-1 male to female predominance. This disease has an insidious onset with non-specific symptoms, and as it progresses rapidly, it might be confused with other diseases like infectious processes, malignancies, and inflammatory disorders. So it's really important for us to recognize the abnormal findings on imagings and do the appropriate biopsies to confirm the diagnosis before starting treatment in order to spare the patient the side effects of unnecessary treatment modalities, and at the same time to provide the opportunity to give the appropriate treatment during the initial stage of the disease when it appears to be the most responsive. So this prompt approach of early recognition and treatment help prevent the development of complications, organ failure, and irreversible changes. And as in our case, after the acute onset, tapering the steroids and maintaining the patient on a lower dose of steroids can help halt the progression of the disease and prevent further flare-ups of the autoimmune system. Thank you all for listening.